Welcome, everyone, and thank you for joining us today. My name is Sandra Underwood, and I am a patient and also a volunteer for Pheo Alliance. Today, we are going to be with Jeffrey Rodriguez, and I will introduce him in just a few minutes. Again, I am Sandra, and I was diagnosed with pheochromocytoma in September of 2019. I was unfortunately having a dental procedure when I crashed and coded and woke up at Northwestern Hospital in the emergency room. There are more details to my story, and thank you to Stephanie, as I was featured on pheochromocytoma.org in July of 2020. And if you're interested, more details are there. Again, thank you for joining us. I want to say at the offset, this program is brought to you by Pheo Alliance, whose mission is to empower patients with pheochromocytoma or paraganglioma, their families, the medical profession, through advocacy, education, and also to provide a global community of support. At the same time, helping to advance treatments and cures. I want to give a special thank you to Progenics for this webinar series on disability, and this is made through an educational grant. Before we get started with the webinar, I just want to take a few minutes to mention a few upcoming events. On March 31st, which is just next week, will be second part of this webinar series on Social Security income. On April 5th, we have our monthly online peer support meeting. Also, again, on April the 14th, there will be a webinar on precision surgery. All these events are located on the website, pheochromocytoma.org. Also, just one thing. All the information presented today is for educational purposes only. And now I will introduce Jeffrey. Mr. Rodriguez has been with the Social Security Income Administration for over 12 years, serving as the public affairs specialist in San Diego and Orange County for the last 7 years. He serves as a windfall elimination provision and government pension officer and trainer in the San Francisco region in the South Coast area. He was the specialist assigned to Medicare Non-Utilization Project and a member of the South Coast Area Representative Payee Task Force. He also hosts a weekly local television show called Social Security Today, which covers Social Security program rules as well as keeping the viewers informed about current Social Security issues. Jeffrey is a member of the San Francisco Region Management Association as well as the Hispanic Advisory Council. And now we will hear from Mr. Rodriguez.
Thank you, Sandra. I appreciate that. And I appreciate the opportunity to be able to be with you all and to share some very important Social Security information. As you know, one of the things I constantly hear or um, will get feedback on is how much information and people get lost within that information. So today I have that um, the opportunity to go ahead and share all of the information that we can try to fit into our time frame, and keep in mind this is more of a introduction to going into some of those things. Then we'll have some time for some Q&A to ask some of those specific questions regarding disability. So let's start off here, and as we go through, and let me get here. This is whenever I give a presentation, whenever I am sharing information about Social Security, one of the things I always try to encourage those listening, those that are in the audience, is first of all, you want to use our website. Our website is designed to be able to provide the very fundamental basic information that is needed to understand Social Security. Um, and especially if you click into one of the boxes such as disability and go through that information, or SSI, and when you go in there, you're going to find links to further information. You're going to find publications that will help give you a better understanding. More often than not, people will reach out to Social Security with a question, and had they gone through our website, they probably would have found it much quicker, easier, and some extra information rather than calling an office or trying to go into our office once our offices are open, spending, a long time, whether it's on the phone waiting to get to a representative or to get to a person in our offices, um, when they could have got the answer right on our website. So I always say start with the website, get the information there, and then you'll be ready to go kind of on to the next phase, which is to develop maybe a set of questions that you want to ask a representative. The FAQs are a fantastic way of getting a lot of that base information. Now, once you've also done so, I would say set up your My Social Security account. The My Social Security account will give you information on your own record. So it's really pulling and extracting from your record to give you. So it's the specific information that you would have to that you would want to know in regards to your account. Now, as we go through, I want to start with going through just some real basic facts, statistics when it comes to disability and Social Security. First of all, is the number of individuals that are receiving a Social Security benefit. When we talk about Social Security benefits, we're looking at, over 60 million individuals that are receiving benefits. And as you saw the amount, I'm sorry, changed it real quick, 5.2 million receive SSI, and some will receive a combination of both. So it just depends on the amount of benefit that an individual is eligible to. And we'll go through and into some of those in regards to what types of programs and specifically disability, as well as the SSI and the access to SSI. But when you look at disability specifically within Social Security, um, there is a great number of people that are receiving benefits. The disability benefit on an average, when we take all of those that are paid throughout uh, a single year and look at what the average is, right now it's about $1,154 on an average that we're paying an individual. And we know that really is not a huge amount. And as you go through, you'll see kind of why that is usually lower than a retirement benefit and what happens with that. But we look at, and what always kind of brings to my attention is the number of people that have a disability and continue to work. Meaning there are a great number of people that are living with their disabilities, still able to function at a point where they're able to work. Then we look at those that have a very severe disability and unable to work, or the disability grows to a point where they're unable to. And that's really where Social Security and disability starts to happen. And so as we look at the process itself, um, I think that's where, I really want everybody to understand what happens, because I think this is where part of the frustration comes in with Social Security and disability, because it is a lengthy process. So let's start with just some of the building blocks when it comes to disability. And that is, what is disability? So SSDI, Social Security Disability Insurance, is a benefit that would, if the individual is approved, would be given to that individual because they are no longer able to work. So the conditions that they have um, are keeping them and impair them from being able to work at what we call a substantial gainful activity amount. So those individuals that we look at, there's a couple things that specifically, when an individual is potentially, and you'll hear me use that word or term in the sense of potentially eligible, because until the individual goes through the entire process and becomes eligible, we can only say that they're potentially eligible. So the benefit is for those individuals that have a condition that's going to last over 12 months or result in death. So we know that if it's going to last over that 12 months or a year, then that's one of the criteria. The next would be looking at their ability to work. And when Social Security looks at this, we're really looking at not being able to work in any capacity, or at least at what we call, again, that substantial gainful activity amount. And we'll go over some of those numbers later. But just to give you an idea, in the sense of it's going to be an individual that has 12 months of a disability or longer throughout that is expected to be with them, and then is someone that cannot work, and the work, if they are able to, is going to be at a certain limit. And so it's roughly like about $1,200 a month gross income or less, so they can work a few hours here and there, but wouldn't be working, obviously, full time with that disability. So that's who it's intended for. That's what the benefit is. It's to um, really just to help and supplement an individual with that, with some type of disability. Now, when we look at the actual definition, or as we start to define for Social Security, the Social Security Act, as you see there, defines a person who cannot work due to a severe medical condition that has lasted or is expected to last at least 1 year or result in death, or the person's medical condition must prevent him or her from doing substantial gainful employment, work that he or she did in the past, and it must prevent the person from adjusting to other work. So again, what really stating there, and we need just to read that to make sure that you understand the definition that comes out of the Social Security Act, or our policy, our rules that guide Social Security, is keeping an individual from working. That's what we're really looking at. So when we consider that, um, that's the primary, or what we'll call the function, the ability that an individual has. So when we talk about retirements, or requirements for getting the disability benefit, we're really looking at a couple things here. We're going to look at a work test, meaning what type of work have you done recently, and what was the duration of that work in order to be eligible. What we call it is you have to be currently insured in order to be eligible for or potentially eligible for a Social Security disability benefit. There are some different requirements when we start talking about the individuals that have um, blind, unable to see, and then the disability. So there's a little bit of difference on some of the work tests there, but we do have that for in disability just in general. So what are the work tests? Meaning, how can an individual become potentially eligible? What would they have to have paid in? Because we said that it's SSDI, Social Security Disability Insurance, meaning the individual has to pay into Social Security. So as you work and you pay Social Security tax, you're paying into the Social Security um, system. Now, when you work and you pay into it, what we look at for disability is actually within the last 10 years. It's always this rolling window, if you will. The last 10 years, have you worked and paid in at least five? Well, for an individual that's younger in age, that really wouldn't make sense, because they probably haven't worked in the past 10 years, right? Like in this case, as we start, anyone who's 24 years old or younger definitely has not been able to work probably 10 years. So what we're looking at that point is we modify the amount of time that is required. So for an individual that is 24 years of age or younger, we're looking for work that has at least 1.5 years worth of work. You get 4 credits, um, a maximum a year. So what we're really looking for is 6 working credits. Each year, the amount of the credit is stated, and so it's right at about 1,000. You know 200, 300, and you'll go through each year, it changes, and so you have to kind of keep up with that if you're trying to see. But you can go through and find out, by taking a test to see if you're currently insured, and using one of the calculators. as well as when we talked about the My Social Security account. The nice thing about that is it'll give you that information and show you right on there if you're eligible or potentially eligible to disability, and what is the length that covers you by. So if an individual is working, a young individual here, and they had 1.5 years of work, then they are potentially eligible. They wouldn't have to work the 5 years, only 1.5. And then it integrates. So from each of um, those time periods, it starts to just grow. Then, as you see, after that 24 to 31 period, when you become 31 or older, then that's where that 5 years out of the last 10 have to be worked. So it's either going to be half of the period that you need to work, if depending on your age, 24 through 31, or once you hit that 31, then we do need 5 of the last 10 years. So meaning this, because it's always a 10-year kind of rolling window, if you will. So if I worked the last 5 years, then I actually have coverage from today. If I stopped working for today due to a disability, I have coverage from today up through 5 years, meaning to apply where I'm currently insured and where I potentially could be eligible for a disability. So maybe I stop working due to my disability, but maybe not at the point where I qualify under Social Security, or I'm able to work a little bit, just not as much, or my conditions are starting to increase. And maybe a year later, I realize, okay, I definitely am not able to work. Well, because I had worked the previous 5 years, a year later, I'm still covered. I'm going to be covered for another 5 years. So that's what that work test, if you will. I don't really like the title of it because it doesn't explain it well. But when we look at the the amount of work needed to kind of cover the individual, this is what we're looking at. Again, although it's even 5 years of the last 10, what we're saying is if someone has worked in the last amount of these years, then you're going to create enough of the paid into to be insured. Uh, when you already are covered. Say you've worked, you've paid into the system, you've checked your My Social Security account, and you see that you do have coverage for the disability, and or you take maybe look at one of our calculators, or you're unsure and you just apply. And you have the question, when should I apply? And this is always a big question too that individuals ask, because different conditions can cause different things. So let's say that someone maybe is suffering with a type of cancer, and they're going through the different stages, different effects of the cancer on them. Well, someone can initially be so advanced that the treatments, the medications, and everything else are definitely not going to allow them to work, right? Whereas someone else may be in the earlier stages and they're still kind of working through it. Maybe they work part time, but they're still working over the substantial gainful activity amount, and so therefore they it wouldn't be the time to apply. But the correct time to apply is when you have that disability that is impairing you or keeping you from working. Once you are no longer able to work due to the disability, from that point forward is where you really want to apply. Because if you continue to work and you're kind of off and on, but you're above the substantial gainful activity amount, then that limit, that earnings limit, is going to keep you from, and you're not able to apply. So it's the point where you're no longer working, um, and that disability has got to that point where it's keeping you from working. That's where I say that's the point that an individual needs to start the process, because the process itself can be very lengthy. It can take a while, and we're going to go through the steps, and I'll explain that so that you have a better understanding of some of the length of time, and what to expect. One of the things that I think is so important when I work with individuals or speaking to individuals about disability benefits with Social Security is you really have to understand the process and the length of the process, so that you don't become frustrated, not knowing what to expect, and didn't realize, well, I didn't know this was going to happen, or it was going to take this long. So we'll walk through those, and that way you have a better idea. So I'm going to kind of hold off for a little bit, going in a little bit more in depth here. I'm going to come back to that. So How does one apply? The best way to apply for disability benefits, in my estimation, is online. The reason that I state that the best way to apply is online is because when you file your application for disability online, what you will be given is a code as you start the process online. And that code will allow you to save your work, go out of the application, and then return at a later time and start up right where you had left off. The reason that this is so important is because what you will find as you go through the application, there's going to be some questions or some information that you may be unsure of. And so it may be asking, when was the first time you saw this doctor? What did you see the doctor for? What was the last time? You think, oh, I can't remember when was my last appointment with this doctor, or what exactly did that doctor or that medical provider, what did they what did I go there for exactly? And so now you have to go back and dig up maybe some of your records, or something else of that nature. So it's going to require that you go and you take some time to look it up. Well, if you make, say you called the 1-800 and you made an appointment and we take the application over the phone for you, the claims representative is just going to be asking you and expect you to have all of that ready so that you can just walk through it. And their time frame that they're given, and normally we're trying to keep it under an hour. Well, that's a lot of information that they're going to be asking in that time. And if you don't have it in front of you, you're not going to give the correct information. It's not going to be complete. Therefore, it's not as solid, or what I'll call, as a thorough of an application. But what we find is if an individual does this online and takes their time to make sure that they've provided all the information that's required, the application information is more thorough, allowing the medical examiner, when it's being reviewed, to really go through everything. And so that, to me, is one of the keys that is so important. So once you file your application, what's going to happen is there's kind of two sections of the application. There is the Social Security administrative portion of the application, and then there's the disability, the actual medical, and everything pertaining to the disability. The first half, if you will, administratively for Social Security, what we're doing is to look: are you currently insured? Who are you? What is the situation, and do you meet those basic administrative or programmatic rules to be eligible for the disability? If we find that you're potentially eligible, then it will take that second portion, which is all of the medical information, your scenario. It goes through several different questions, how your function, what you're able to do, how much amount of time can you walk, are you able to do this? Just a lot of questions, medications, all of these things, right? Then that is sent up to what we call the disability determination service for the state of for here. The state of California does that for us. So we review the Social Security programmatic information. Once we sure that you meet those requirements, we then send it up to the DDS, as we call it, Disability Determination Service, and they're going to review all the medical side. We are not trained medically, so, and this within the Social Security office, I can't look at a claim and say, hey, this is definitely going to be approved, or this, wow, yeah, this looks like this has substantial. All we can do is make sure that they're complete and then send it up to DDS. So as we're looking at that, that's, important that everything is there. The state will then, through the DDS, is going to make that decision. Is the individual meet the criteria? So there is a whole listing, and we'll go into some of the depth at another point within the presentation, whether the first part or the second part, probably, as we look a little deeper. But the state is going to determine, do you meet that criteria for the for the Social Security medical determination? Do you meet that criteria for a disability? So the doctors will look at all that. They're going to take all of your information, any doctors you've seen, any whatever the specialists have stated. Now, if there is a need in there, they may send you to a third party physician to be reviewed about a very certain particular part, something maybe that you listed and there's not enough information for us to make any type of determination, or it's very close and we want to take a second look, then we're going to send you to a third party physician for that. And you'll receive notification and an appointment for that. Other than that, we're going to use all of the information that you've given us, the medical evidence that comes from your doctors. So you'll sign off and give us the ability to request that, and we'll do that. You don't have to bring in that whole stack or that box of information. We are going to request that of your medical providers, of anyone that you list. And that's why it's so important, again, to do it online, is because we need you to list the doctors, their contact information, the first time you saw them, what you saw them for, the last time you saw them, what kind of medications do they give you, what kind of treatment, all of that. And then we're going to go through to that medical provider request, and they're going to send that in. And all of this is going to create the medical folder for the state agency, the disability determination service, to review this and say, is this and does this meet the criteria? Now, one of the things that we look at on the onset is what we call compassionate allowances. Compassionate allowances is our ability to say, we see there are a certain um, level of a disability that is so severe, or we can quickly identify based on your medical information that you meet that criteria, and we can approve it quickly. So it goes through an expedited process. Now, you don't have to worry about knowing exactly. You can always go to our website and look up what are those actual compassionate allowances, or CALs as we call them, and you can go through the listing and see what those impairments are. But as you list them in your application and on those forms, the system will automatically pick up and identify and say, here is a compassionate allowance. We need to look at this. This meets that criteria, so that when it goes to DDS, they are going to say, this needs to be expedited because they've listed that. And just, is there the criteria, the evidence that shows and demonstrates from your medical provider, your physician, that this is, and you meet that criteria, so that we can evaluate quickly. If not, if you don't have a compassionate allowance, that's okay. What we're going to go through is making that determination, right? The, again, DDS, not us personally within the Social Security office, but they're going to be reviewing all of the medical information, saying, one, they're going to be look and say, are you working? If you are, to what level? Do you meet that criteria? How does it affect your ability to work, your impairment, this disability? What is it doing to you to impede your work? Then they're going to look at the medical condition itself. Does it meet that compassion allowance? Is it something that we just say, hey, this is part of that listing, we know for sure, yes, this person has this condition, we have to do it. If not, then they're going to look at all of those conditions, and they're going to push them up against the Social Security regulations for medical allowances that allow the disability, and see if you meet that criteria. Then they're comparing things like, what were you able to do prior and what are you able to do now? Not only just work, physical work like at a job, but also within the home. What things within your home are you able to do hygienically? Are you able to care for yourself, or even cooking, or cleaning in the home? How are you able to move around? So we're looking at all of these factors that are going to make and allow the disability determination service to come up with and say, okay, here, when we look at, and what is called the blue book, and you can go through all these things that I'm talking about are on our website. And that's why I always say, go to our website, because you're going to see this listing. And on this listing in the blue book, which usually is used by physicians that are reviewing to see, do they meet Social Security levels of disability. But you can as well, and say, oh, well, my doctor said it listed as this, this, and this. If your doctor lists something and uses a different terminology than maybe what it really is, the issue or problem with that is, when it gets reviewed, it may be treated as something less, or it may be treated something with a different name, and it has to be exact to what is listed within the Social Security Blue Book, or under that listing. So, um, that's where your doctor can really help out in the sense of not to make up something or give false information, but rather make sure that the terminology that is being used is correct, because that's going to have a lot to do with you know if you're going to be approved. Now, once it gets reviewed, we will notify you through mail, through a letter. We always use the USPS. So don't expect a call. And that's where all those scams come in. Someone calling, give me your social security number. This, no, no, no. We will send you a letter and you'll receive that in writing as far as being notified to what the status of that determination is. So, what I want to do is kind of walk through, because maybe you're not going to agree with that decision. They deny you. You're going to have 60 days to appeal that decision, and it's really important that you realize the time frame that you have and to act upon a denial right away. So let's kind of go through. So you have this initial application that you do. Time frame wise, it's going to take us about 6 months to 9 months normally. Right now with the pandemic, it may be closer to a year, but 6 to 9 months for us to gather everything after you send in the application, make sure it's complete, send it off to DDS. DDS will review it, make a determination, sent back to us, and the notifications go out. If it is denied, then at that point, what you would be doing is looking at the next level, which is you would file what's called a reconsideration. So your first level of appeal to a denied initial application is a reconsideration. That reconsideration can also be done online, much easier again to do it online. And what we're asking is on the criteria that you provided, are there any changes, update, any proof, anything you need? And what we're really saying is that in the initial application, those compassionate allowance, the, the the disabilities, the impairments that are going to be used and that potentially would be um, approved are going to be at a level that is extremely high and easy for the medical examiner to say, we know that this condition will not allow the individual to work, it impairs them from working. Because remember, the key here is not so much do you have a disability, does it keep you from working? So the initial set is what they're looking for. So it might be denied because it's really close, or maybe there isn't sufficient evidence, or it's not real clear if it's meeting that criteria. So they deny it. So then you turn around, you appeal it, and you ask for reconsideration. What that does is it says, we're asking you to really look at all the parameters, open up everything, and see, does my condition and my situation, does it meet this criteria? So the initial application, like I said, takes about 6 to 9 months, maybe a couple much, a few more with the pandemic. A reconsideration is going to take about 9 months to a year. And once you get that determination, let's say that the determination is denied, then your final and next appeal would be to take it before an administrative law judge. The administrative law judge is then going to review, and this is where I like to say this is the human factor coming in. So we've used the criteria based on these listings, and it's very clinical. It's very, you either meet that criteria and it's listed specifically to those listings, or you don't. Once it gets to the hearing, the judge has the ability to provide kind of that human factor and say, okay, I get it. We didn't might quite meet these criteria, but it's on the threshold of several or two or three or four of these. And it's obvious that evident that the individual cannot work due to these impairments or disabilities. Therefore, the judge will say, okay, I will approve it. But to get before the judge, just like any other legal situation you've seen the courts recently, it will take about 2 years, a year and a half to 2 years to get before a judge. So we're talking 6 to 9 months initially. We're talking about a year in the reconsideration, and then we're talking about 2 years in the appeal. When you add all that up, you're talking about a 3 to 4 year process. And I believe it's so important for individuals to understand the length of this process, because if not, you're going to get a little frustrated that you didn't get this answer right away because your disability, your impairment, is obvious to you and you feel it, you're unable to work or whatever the situation may be. But to get approved for us, because once you're approved for disability on the Social Security side, this is something that we're expecting to last for a great length of time or the rest of your life. And so that benefit is going to be paid at that length of time. And once you're approved, it's very difficult to fall off because we build in these buffers around it where you have these trial work periods. So even if you're able to try to go back to work, we're going to create up to 9 months that you can do so. If you meet above a limit, then it kicks you into a 36-month or a 3-year, what we call extended period of eligibility. So there's this great length of time, somewhere around 5 years, that once you get into a disability and approved, that it's going to last. And so we really need to do our due diligence and make sure that the individual is eligible. So that's why all this process can be so lengthy. Now, when we look at SSDI, Social Security Disability Insurance, the benefit is not only for the individual, it opens up benefits for the family. And who can receive on that? Well, it can be a spouse, depending on that spouse's age. They have to be at least age 62, or if they're caring for a child that's under age 16 or a child that has a disability, then that spouse can be considered to receive benefits under the disability benefit under the number holder. Um, Even divorced spouses may potentially qualify there. Then, when you look at children, what we're looking at is minor children under age 18. If they have a disability, as long as that disability was proven before age 22, then that adult child with disability can also be receive a benefit under the parent's record once they're approved for the disability. And as I said, an individual can work. There are some work incentives that allow an individual to work, and so it may be lower, maybe it's controlled due to the disability, but that allows someone to, if they're able to, one, to continue to develop and work through a disability, but also provide some additional income into the home, which can be very important. So I've gone through a lot of information here, and it's at this point that I want to stop sharing in regards to the disability. And what we'll do in the second part is pick up under the um, the when we come back on the second part, what we'll look at is the SSI, the supplemental security income portion of the um, an individual's disability and benefits through Social Security. So there's a lot of information, and I'm really glad that we're breaking up in two parts, because when I do give both of these together, it's kind of overwhelming, and individuals really aren't able to capture everything. And so I think this is a great way for us to take a look at it and to develop it a little bit. Take one portion first and then take the other portion later. So, Sandra, I'm going to ask you to join back. And I know that there's probably some questions that we want to go over, and this would be the appropriate time to do so.
Okay, thank you, Jeffrey, for your time and your dedication to our Pheo community. It has been wonderful listening to all of your explanations. I do have a list of questions that were submitted beforehand, so thank you to the community. I will say that 90% of those questions have been answered already in your presentation. So again, thank you. At this point, I will ask a few questions. Some of them are a little specific, but you'll give us your explanation. So thank you in advance. So here's the first one. I have malignant paraganglioma. Will my multi-site metastasis, do I qualify for disability by diagnosis alone? If not, what is the best qualifying criteria?
You know, it's a great question, and thank you for asking that, because when it comes to disability, as I mentioned, there's this lengthy process that the disability determination service will look at. It's never really just one specific thing that's going to trigger everything, or really allow in the overall sense. It's combined. It's what is the condition, what is the function, how much are they able to do, can they work in any capacity. A lot of times people think, well, I'm no longer able to do my job, what I was trained for, or my educational level. And that's not what Social Security will look at. Social Security will look at, are you able to work in any capacity? And that's a huge difference when we're looking at that. So, depending on where you're at, so you may be diagnosed. Now, the diagnosis at times can be enough in order for Social Security to say, if this is the diagnosis, then we know that you're going to be eligible based on this criteria. But oftentimes, even with a cancer or that, we're looking at the different stages. We're looking at to what level has it impaired the individual. So um, I'll take as an example. My niece was um, uh, diagnosed with lupus. So when they took a look at that, her condition at the time had become to where she had no strength, couldn't move, couldn't walk. It really had impeded her ability to do anything as a 20-year-old young lady. But through some of the medication and treatment, um, just within a few months, she's made substantial changes and increase to the point where now she's able to continue moving around. She continued her studies and able to function at a whole different level, where initially she wasn't able to do, maybe shower by herself, or just not enough strength, whereas now she is. So we're going to look at all those conditions. So it's not so much just the diagnosis, although that will really allow us to make at least an entry, say, okay, under this diagnosis, if the function is already there to where they're enabled to work, and that's portrayed to us, I've had to leave my job, I can no longer, I can't stand, I need to sit, I need to lay down, I have to sleep, the medication causes me drowsiness, whatever that other side of it goes, then that's where what so it's a combination, if you will, of everything together that allows the determination and then the decision to be made. Although there are diagnoses such as ALS that we know, and at that point, once it's diagnosed as ALS, then that individual is eligible immediately.
Again, let me say your explanations are covering a lot of these questions. So I'm going to try to find one. I'm going to try to stump you and let's see if I can get one. I think I have one here. I'm going to read it because I wasn't quite sure what they're asking, but you probably will. Here we go. On long term disability, on private insurance, still through work, do I still have to apply for SSD? Am I supposed to be covered until retirement?
Okay, so when someone has a um, an insurance outside of Social Security for a disability, a long-term disability insurance, there's a major difference when we're looking at it from the Social Security side between a private insurance and a workers' comp insurance. When an individual files for disability, and I kind of go back to, as soon as you have the disability, as soon as you meet the criteria due to function, the impairment, unable to work, that's when you're filing for that Social Security disability insurance. If it is a private disability insurance, long-term disability, that is not going to affect Social Security disability. So there would be no sense in not filing and becoming eligible and receiving the benefit from disability, because it's not going to affect, one should not affect the other. Now, if the individual had a workers' comp type of claim, then what happens is the individual can file for the Social Security disability, but we're going to decrease the benefit due to the amount of, depending on the amount of the workers' comp benefit that the individual is paid. So it just depends on what type of disability we're talking about that you receive in addition to. And I still come back to say, always apply for the Social Security disability. It's best, and because it's such a long process, you want that to start. The key here again is the working. Are you working and being paid for work? That would create where you're not eligible. That would put you over the substantial gainful activity. If you are not working and you have that impairment and it was due to the impairment that you're not working, that's where you want to start and request the benefits.
Thank you again. And here's another one I think is similar. How do I sign up for Medicare disability?
So there is, and that's a great question, because there's a couple ways that disability will allow you access to Medicare. The regular kind of initial way that an individual is eligible to Medicare is after 24 months of being approved for a Social Security disability, the individual then is meets the criteria to be eligible to Medicare from that point forward. And if you are eligible to the disability and we are awarded, we will automatically enroll you into that disability after that 24-month. And let's say that it took 3 or 4 years. Well, then, because we use the protected filing date, we go back to that initial application. We say, well, you already met the 2 years, so Medicare would start immediately from that point moving forward. And then, out of your disability benefit, the Medicare premiums would be paid for you. The other option is, and this is a very unknown, very specific, and the only reason I know is because I became an expert and worked on these types of claims for an individual who continues to work with a disability and be approved for Medicare. And this is very specific. It's most of the Social Security staff may not even be aware of it. If you tell them, "Hey, I'm still working. I'd like to file for a disability in order to get the Medicare," they may not be aware it, but it does exist. And so we're saying is, if you meet the criteria, your impairment, that disability meets all the criteria to be eligible for a disability, but you select to work through that disability and continue to work, then you have potentially the eligibility to become eligible to the Medicare. So then you're filing a claim for Medicare due to working while disabled, and that's a whole different process. It's still very similar. You're going to have to go through the process to be approved. But once you're approved, then it can cover. And after the 24 months, same exact situation, but it allows you to continue working, so you get no um, financial benefit, right? Economic benefit. So you're not going to be paid for the disability, but what you would receive is eligibility to the Medicare, and there are many individuals that require that, and so that would be the way um, to file for a Medicare benefit while working with a disability.
Okay, let's see if I can stump you. Do you have or do you know of any specific statistics with regard to pheochromocytoma and paraganglioma and us receiving Social Security?
Saying it now, now there's the one you're going to stump me on. No, I don't have any type of specific um, data to something that specific, unfortunately. But that may be something that your group does have, Sandra, as far as how many people have filed. And you can always push that up against the 2.2 million people that receive a Social Security disability. So I'll throw it back on you.
Okay. All right. So I'm going to be a little personal here. I am in the process. I filed for disability about 4 months post surgery because I had some attendant issues. So I filed, was denied twice. So in 2 weeks, I will be before an administrative law judge. And I have to say, it will only be 2 years and 3 months. So a little less than that, 3 to 4 years. So it may depend on the state that we're living in. So for me, again, it will be about 2 years and 3 months. So I have my hearing in about 2 weeks. Any advice for me?
Um, the initial advice would be, trust the system. I get this question a lot. Do I need to do this? Do I need to bring in a lawyer? Do I need, you know, my advice to close friends that have filed for a disability is to say, just provide everything that is going on. Make sure you got the medical um, documentation, that everything that you've gone through and that your doctors have provided. Make sure that that's in there, so that the judge is reviewing that. On the other side is your personal side. Tell your story. Make sure that the judge understands how severe, what is the function. Again, I go back to that function, because one aspect is the medical, and if it's already listed and approved under that listing, or it's right at the line and maybe doesn't meet all the criteria, it's going to be this impairment or this disability has affected me to where I can't do this. And it may be something small that you're thinking of, well, I can't wash dishes anymore. But the judge needs to know that, especially, like, I'll take for me, I love washing dishes. I find it relaxing in a weird way. I do. And so, if there's something you're able to do and then you can't do it because of an impairment disability, that you have loss of function, and that is what the judge is really looking for. What has been lost, what is the level that you're able to do. So, just because maybe you now have bought slip on shoes, let the judge know, I can't tie my shoes, so I now have sandals, or I have slip on shoes because I can't do that. I can't bend over. I don't have the strength to do this. Whatever it may be, you have to really tell your story, because if not, there is no way for that judge to know how it has impacted and what it has caused you to lose as far as your ability to do certain things. And you may say, well, I'm pretty good for about an hour or two at most, but that is it. I cannot do anything beyond that, due to exhaustion, or because of the treatments, the medication. I have to lay down. It causes me to become very drowsy and sleep. I can't drive. I can't even walk at that time. Whatever it may be, you have to tell your story. I wake up at night and can't sleep because the medication is so strong, it keeps me awake at night, or the pain. Those are the things that you need to tell. That is the option. That is the opportunity when you see an administrative law judge, you go before the ALJ to give your story.
Again, extremely thorough. I really appreciate that. So we have a few more minutes. Let's see if I can get a couple more questions in. Okay, so the process of being diagnosed with a pheochromocytoma, sometimes I just can't get that word out. So let me just say pheo or para. The process can take years,
Mhm.
5, 6, 7, 10, or 15 years. And a patient is undergoing so much with the symptoms. What do they do if they don't have a diagnosis, but yet they're impaired because of their symptoms?
Right. And that's a great question. If you're already going through the symptoms, um, I would say to still file. Let the diagnosis, let that maybe come later, um, because, and I'll go back to and use the example of my niece with the lupus. Luckily, they caught it very quick and early. But we also know through reading that, because these symptoms mimic other symptoms, they it is often one that is difficult. So they'll think it's something else and kind of treat it for something else, and it's this hit or miss. But the effect of the disability or the symptoms is already occurring, and so maybe those don't meet all the parameters. But if you start the process and you file the initial claim and maybe it's denied, and you go through the reconsideration and they look and, well, it doesn't meet the criteria, but your symptoms are definitely there. That's where going before the administrative law judge to say, okay, we still haven't. And maybe at that point, they still haven't been able to diagnose it completely or exactly under this, but that's okay, because it may be on the, close to other ones, or the listings may not meet all the criteria, but it's right at the line. And along with your symptoms or the function and change, the judge at that point would be able to make that determination, say, you know what, we're going to approve your claim, even though they don't have that exact one. So it's at the ALJ stage that he's able to override the actual listings. So in the initial and the reconsideration, although the listings are the only thing that they're able to use, not at that last level. That's where maybe there isn't a diagnosis, but it's very evident that whatever all this is keeping the individual from working.
Again, thank you so much. So the last question is going to be for you and about you. Okay? Can I ask, and
Thank
maybe the community may want to know also, but what brings you satisfaction for doing this type of work?
Oh, we would have to spend literally a day or
Mm,
two talking about that. Um, when we're impacted by family members that have disabilities, when we, or ourselves work through certain disabilities, uh, it allows us to have that empathy and to say, thankfully, and you know, I don't maybe have it at this level, or I'm able to function without, but we realize there's others. And so for me to be able to represent Social Security as a public affairs specialist, when I did the claims rep um, work, it was to be able to help an individual through this process. It can be a very scary process for many. It can be a very difficult financially, emotionally, that individuals go through. And because I had the privilege of helping my mother take care of her elderly father, because we've had the privilege of working around on the personal side. I am very involved in my church, and I work with families that have special needs children. I work with families that have family members that have severe conditions, or elderly that have conditions. um, I get a joy and satisfaction of helping, whatever my role is in all those different capacities. If I can just make someone's day a little bit better, if I can help bring some clarity to a confusing, um, gray area of life, then that brings me satisfaction, just to be able to help. So that's why I continue to do this work and love what I'm doing. I have the best job in the whole world, and especially within Social Security, and especially in my role as a public affairs specialist, to share this information with others. And so when I prepare, when I do this, I try to do my best to look at each presentation individually and provide, what am I going to provide this group of individuals? What do they need to hear, and prepare for that? And that's where my job satisfaction comes from. Thank you for asking.
Oh, you're welcome. And I can say that your passion and your empathy certainly comes across. And I don't think I'm the only one to say that. So I want to say thank you. And at this point, we'll start wrapping this up. This webinar will be available on the website in a few days. We will also transcribe the questions and have those available. If this information has been useful to you and you're interested in donating, you can do so at pheochromocytoma.org/donate. Again, special thanks to Progenics for making this webinar series possible through an educational grant. Thank you everyone for attending today's webinar, and we hope to see you again next week for a part two on Social Security income. Thank you and have a wonderful day.